excited to be able to share with you today. For those of you who are familiar with Manhattan Research, we do studies of consumers, physicians, and other healthcare professionals looking at technology adoption, online behavior, and how they're finding information and sources for their health. We've been doing our Cyber Citizen Health study for 11 years now, and actually the 2011 research I just got for the first time on Friday. Usually I have about 6 weeks to get to know a data set before I have to present it for the first time, so you'll have to forgive me. But I don't have all my numbers memorized yet, and I'm hiding a couple of them because they haven't gone through all of our QA. But I was really thrilled to see some of the results from this year's study and be able to share it with you, because what happens a lot when you're doing surveys of the general consumer population is, you hear about a lot of these, the exciting work that's being done by a lot of the e-patients we heard from yesterday, just amazing stuff. But you don't necessarily see that playing out in the general population. But what was really exciting to me is a lot of these things that we're talking about in our own kind of internal echo chamber, they're making it out there into the general population. So I'm very excited to talk about some of those changes with you here. So just to go through what I'll be talking about, this started out as a random digit dial telephone study of about 4,000 US adults. It's now about 8,700. We do a telephone interview with about 4,000 consumers and an additional roughly 5,000 that we talk to online. So a really terrific data set to work with. Fielded throughout this summer, and again, hasn't yet been released. It'll actually be released in a couple of weeks, but this is just me cobbling it together over the weekend. So I wanted to start out, the great thing I love about this is really taking a look back at the last decade, being able to compare the results for the past 10 years. So I wanted to show a few of those things that have changed. What's been remarkable is, even though I think you probably heard that kind of baseline internet adoption is plateauing to a degree, but we've seen just really a lot of steam still in the growth of e-health and consumers also researching pharmaceutical information online, which is that second line there. So we're at a point now where at about 3/4 of US adults, that's not 3/4 of online consumers, that's 3/4 of all US adults. So most online consumers are doing some sort of health information seeking activity. And about half are doing some sort of pharmaceutical information seeking. Now, what's been fueling a lot of that growth over the past 5 years or so is in the 55 and over crowd. We were at a point of saturation in the kind of 18 to 35 group. So we've really seen a lot of that strong growth happening in the 55 and older group, which, of course, then means that a lot of these therapeutic categories that you used to think it wasn't going to be relevant to try to talk to osteoporosis patients or some older type 2 diabetes patients who are taking insulin, for instance. But we're at a point where you're hard-pressed to find a therapeutic category where you don't have that basic, of about more than half of patients looking for health information online. So what's been going on these past 10 years, some kind of interesting comparison is, as we've seen this huge growth from about 23% 10 years ago of US adults online for health to almost 3/4 today. At the same time, we've seen a decline in consumer reliance on physicians. Now, I don't necessarily mean to imply a correlation here. There's a lot of access and affordability issues that we've heard about in the news recently that's driving a lot of that declining reliance on the physician. But there is certainly a shifting power dynamic that I'll talk about toward the end, as we're moving away from this kind of physician-directed medicine, the Marcus Welby that we heard earlier, toward this idea of participatory medicine, and I'll talk about that a little at the end. So I just wanted to highlight a few of the things that jumped out at me comparing these 2011 results as I was scanning through them versus the 2001. If you kind of go back 10 years, what's been changing? Number one of the shifts is that consumers looking to their health insurance company. We all certainly know the importance of that payers now play in healthcare and driving a lot of the decision making. Back 10 years ago, the health insurance company was just kind of behind the scenes paying the bills. Patients didn't have to be aware of them. We all know patients have to be very aware of their health insurance companies today. And as a result, we've seen about double the number of consumers actually saying they're using their health insurance company as a form of health information seeking. Something else, this might not sound that dramatic in terms of the numbers going from 10 to 18%, but it's really speaking to a larger issue that I'll talk about earlier that really kind of struck me in looking at the results this year. This idea with the aging baby boomers, we're seeing a lot more caregivers, about twice the number of caregivers saying, and that's a very conservative estimate of people raising their hand and saying that they are a caregiver for someone with a chronic condition. The other metric is that we saw a huge increase in somebody who's saying that they're kind of managing the health for a parent in many cases, and the degree to which that's driving a lot of this online health information seeking. So I'll talk about that a little later too. Of course, we've seen a big jump in not as big as I think a lot of us would have thought 10 years ago, but we're starting to see the communicating with the doctor electronically taking off a bit more, moving from just email back in 2001. Of course, we're incorporating email, IM, online video. It's starting to take off. We'll see kind of how that happens, and I think we're looking to this, to the kind of telemedicine concept to really drive a lot of the innovation we'll be seeing in the years going ahead. And then certainly, no surprise to anyone here, huge growth in use of online communities. Now this is kind of another rather conservative metric of those who are using online communities out of all US adults. If you look at the broader spectrum of consumers using some sort of social media, blogs, ratings, et cetera, it's much higher. We saw it was about a third the last time we had measured this. We'll have the numbers in a few weeks, but it's looking like we're getting closer to half of US adults, don't quote me on it yet, but getting toward using social media. So a big shift there. And then finally, your top search engines have changed a bit too. Some other things I just wanted to quick highlight. We talk a lot about nurses and pharmacists playing an active role in patient care. We're seeing that actually taking, kind of playing out in this data, and consumers. I think what we really hear is they're looking for a more empathetic relationship with their healthcare providers that they're not necessarily getting from the physician. And if you take one thing away, we see this in the physician as well, it's just you can't underestimate how busy physicians are today and how hard it is for patients to really get their questions answered. I talked a little bit yesterday about some of the pain points research we did in this study as well. Some really interesting stuff coming out of that about where the pain points are in our healthcare system. What I was shocked and very excited is, getting kind of if you're doing a survey of all US adults on the telephone, getting people excited about electronic data, electronic medical records is really quite difficult. And we haven't necessarily seen that, but we're finally really starting to see patients get excited about that and start to have some expectations. So I was very pleased about that. Mobile, there's going to be this is really, it's not just talk, it's really happening. And it's happening much more quickly than I think we were expecting. Then also search. Don't underestimate search, especially when on this mobile front. People get very excited about apps. The bulk of what's happening for health right now is people using Google on their phone to search, just like it is in the internet world as well. So really keep that in mind as you're thinking about the mHealth opportunity. And then as I talked about earlier, this caring for family, especially in a former caregiver role, that's really going to be, we're seeing it already play out, and kind of looking out in the next couple of years, that's something you've really got to keep your eye on. So moving to the new influence map, we were in this again. It's not just in 2001. It was very much this kind of physician-directed medicine. The physician was driving the treatment decisions, and we're really seeing this overall ecosystem with the patient at the center, and we're starting to really see that play out with your average consumer today. It's no longer just symptom research that's driving online health info seeking. We're seeing that kind of moving throughout the treatment continuum. Patients are starting to use the internet as a tool in a variety of situations to help manage their condition in an ongoing way, which is where some of the really powerful stuff starts to happen. Certainly we see that within certain therapeutic categories. And we're also seeing, I mentioned earlier the pharmacists. Patients they're not getting what they need from their doctor. They're pulling from these communities. They're using their pharmacists, nurses. It's really a much bigger ecosystem today. So we'll be diving into that in the next few weeks to really understand how this is starting to take form. Just in the interest of time, I'll skip through this. So. Where are we on this kind of trajectory again toward this participatory medicine? Last year, we wanted to understand there's this idea of the e-patient being an empowered patient. And just because somebody's researching health information online, which is what drives a lot of the health info, kind of the e-health behavior today, does that actually empower them? Is that changing their behavior when they go to the physician? And so last year we identified that there were 99 million what we called e-empowered consumers who had made some sort of behavior change or changed a treatment as a result of the information that they were finding online. One of the top activities in the US that we saw was consumers saying that they were using the internet instead of going to the doctor. Interestingly, in Europe, among the e-empowered consumers, it was more about discussing the information online with the appointment. We're not necessarily seeing that kind of replacement play out in Europe as much as we are in the US for reasons I think a lot of us can understand. But even seeing something like 27 million consumers saying that they're asking a doctor to change their treatment because of information they find online. So some substantial numbers of patients who are really going in there and saying, hey doc, I'm an expert here too. I'm using this information to actually change what's going on at the point of care. So it's always fun to look back, and for those of you, I've been in e-health for 12 years now. I love that video. I was remembering at my kind of first startup, we'd all pass the internet cord for the dial-up around and dial onto AOL if we needed to send an email. And it's fun to think, back then it seemed like it was just about to happen that we were going to start. It was going to, go away from content. We were going to have all of these tools that were going to be driving change in behavior and kind of that connectivity between the patient and the physician. But I think it happened a little slower than a lot of us thought. So we're kind of getting toward this. If we look at where we are now, so we have this health information seeking bar that we talked about earlier in the blue. And then the small little lines down here are using some tools, things like that really start to drive that connectivity and care, things like PHR, refill reminders, symptom tracking, et cetera. Now, we didn't even kind of bother tracking them necessarily back before 2006, but what's exciting is in this 2011 research, it's a change. It's starting to pick up. Guess what's driving a lot of that? Mobile, of course. That's really, and I think a lot of us are getting that going to kind of typing it into the website and doing the management over there was inconvenient. Mobile's really is, and it's happening, driving a lot of that on-the-go access to these types of tools. And consumers actually starting to, at the general population level, care about entering information into their personal health record, care about taking it into the physician. So you see that growth curve is steeper. So it is finally starting to happen. So looking at just trying to evaluate where are we on this journey from that physician-directed medicine, the physician is kind of the authoritative figure in that conversation, to having more of that dialogue with the patient. So if we're looking, if you think about it, I think that the two things that are at play here are one, kind of on the x-axis, of course, going from physician-directed to that more participatory style of medicine. That's happening. We see that playing out. And at the same time, content and, if you will, knowledge, medical knowledge, is going from static, what's in the textbook is the appropriate treatment for that patient, toward having real-time information and tools that will allow us to customize the treatments. And I think, as we've been talking about here today, that a lot of what physicians think they know, in many cases, doesn't apply to every patient. And we're seeing that play out more and more. So we're getting to that point as things like the real-time monitoring, social media, and all of the amazing empowered patients that we've heard from the last 2 days are starting to play out. But what I think is incredibly exciting is what's hopefully the next 10 years. And I do think that it seems to be, especially after seeing these 2011 results, it's accelerating faster than what we've seen the last 5 years. We're getting into that exponential growth curve. So now we're going to have things like genomics, of course, real-world data, the electronic medical records, all combining to really be able to not do this one-size-fits-all medicine, but really understand what's right for that individual patient, which, of course, is a huge shift in the mindset for our healthcare industry. As Seth talked about this morning, it's getting away from that factory medicine toward really personalized medicine. And we're seeing it happen in kind of really exciting ways. So just in thinking about, we're talking to a lot of pharmaceutical clients, of course, and I think they're all a bit, how do we start to evolve our business model, which is, based around, sending out a rep to deliver 3 points in a close to a physician who, can't find a spare couple of seconds during the workday, and the DTC ads, which really aren't going to be suited to a lot of the much more targeted therapies that are in development right now, and a whole host of other things. How do you start to evolve those organizations to account for the world we live in today? Number one is, of course, developing a more holistic view of healthcare delivery. It's not, for all these years, it's just been about get the message out to the physician. Now it has to be about, it's not messaging to the patient, it really is about talking to the patient and those one-to-one relationships, as well as understanding that overall ecosystem of caregivers, pharmacists, nurses, all the other stakeholders that are influencing patients in their healthcare decision-making. And this is going to be huge, and for pharma companies especially, given the silos that are in place, this is not necessarily an effort of one marketer. This is something that has to happen across the organization to really rethink how do you develop so that you're not just, you're equipped to have one-on-one conversations with patients and start to deliver on that personalized medicine promise that's coming, because that's a big shift for these companies. And then finally, we're moving away from it's not just content and one-way static information seeking. We really are getting to this world of patients demanding, physicians expressing interest in this next generation of digital health, which really is around the monitoring, being able to interpret data and information for that particular patient to develop an appropriate treatment plan, and how do you develop tools that enable that process. And it's a real challenge because, of course, it's a very different locus of control for a lot of these companies, but a lot of very exciting, I think, opportunity for everyone, and I think for pharma to really revitalize its role in healthcare innovation and as a source of inspiration, kind of innovation in healthcare delivery. So some exciting opportunities there. So thank you. Thanks.